Hey people, are you smokers? Do you want to quit smoking? If yes, let me ask you one more time. Why do you want to quit? Do you know the reason you want to quit? Okay, if you are not sure, ask yourself these questions. First, what do I dislike about smoking? Second, what do I miss out on when I smoke? Third, how is smoking affecting my health? And then, what will happen to me and my family if I keep smoking? And last, how will my life get better when I quit? Here are some reasons to consider. First, want to look, feel, and be healthier. Second, want a better lifestyle. And last, want a better family life. Just make a list of all the reasons you want to become smoke-free. Keep the list in a place where you will see it often, like your car or where you use to keep your cigarettes. When you feel the urge to smoke, take a look at the list to remind yourself why you want to quit. There are many kinds of tobacco products. Cigars. Cigar is defined as a roll of tobacco wrapped in a leaf tobacco or in a substance that contains tobacco. It differs from cigarettes in that cigarettes are a roll of tobacco wrapped in a paper or in a substance that doesn't contain tobacco. Cigars contain the same toxic and carcinogenic compounds found in cigarettes and are not safe alternatives to cigarettes. Smoking cigars can increase cancers and coronary heart disease. Bidis and kretek. Bidis are small, thin, hand-rolled cigarettes imported to India, United States, and other Southeast Asian countries. They comprise tobacco wrapped in a tendu or tambourine leaf and may be secured with a colorful string at one or both ends and can be flavored or unflavored. Kretek are sometimes referred to as clove cigarettes. They are imported from Indonesia and typically contain a mixture of tobacco, cloves, and other additives. Both have higher concentration of nicotine, tar, and carbon monoxide than conventional cigars sold in the United States. And also, neither Bidis nor kretek are safe alternatives to conventional cigarettes. Bidis smoking increases the risk for coronary heart disease, acute myocardial infarction, chronic bronchitis, and several types of cancer. Kretek smoking increases the risk for acute lung injury and abnormal lung function. Low-yield cigarettes. Low-yield cigarettes are those that tobacco manufacturers label light, low, or mild. Low-yield cigarettes were safer than regular or full-flavor cigarettes. However, low-yield cigarettes are not less harmful to health than regular cigarettes. E-cigarettes, are known as vapes, are not safe for youth, young adults, pregnant women, or adults who do not currently use tobacco products. Some vapes look like regular cigarettes, cigars, or pipes. Some look like USB flash drive, pens, and other everyday items. Even the vapes are less harmful than regular cigarettes, but that doesn't mean that they are safe. It can contain harmful substances including nicotine, heavy metals like lead, volatile organic compounds, and cancer-causing agents. Don't use e-cigarettes if you want to quit smoking because it's not approved by FDA. As far as scientists know, vapes can cause unintended injuries, toxic to developing fetus, can harm adolescents' brain development, and of course can cause cancer. We know that smoking leads to disease and disability and harms nearly every organ of the body. Smoking can cause cancer, heart disease, stroke, asthma, diabetes, gum disease, HIV, vision loss and blindness, and last, mental health condition. Alright, I'm sure that you really want to quit smoking. So, these are the tips for quitting smoking. First, make your environment work for you, not for smoking. You can wash your clothes and anything else that smells of tobacco smoke. You can ask the people you trust for help, and let your healthcare professionals such as pharmacy know you are quitting so they can provide encouragement. Secondly, distract yourself. When you have an urge to smoke, it may feel like the only thing you can focus on. For example, listen to your favorite music, play video game, or watch a funny video. Make a list of good ways you can distract yourself. Try them out before you quit. Save the list. Then, when you quit and get an urge, you can immediately choose something from the list. And then, find safe substitutes for cigarettes. Find some substitutes for cigarettes for your mouth and hands, such as toothpicks, straws, or cinnamon sticks. Keep them close by when you quit. In the days before you quit, try out different substitutes instead of smoking a cigarette. See which one works for you so you can use them when you quit. The last one is adjusting your medicine. You can talk to your pharmacist or other healthcare professional about which quit smoking medicine is right for you. There are 7 medicines approved by the FDA to help you quit that are divided into 2 groups. First, nicotine replacement therapies, and the second one is quit smoking pills. Let's talk about NRTs first. There are 5 types of NRTs. Nicotine patch. Nicotine patch come in different shapes and sizes. They are thin and stick to your skin. You put one nicotine patch on your skin in the morning and leave it in place all day. It releases nicotine throughout the day, which is absorbed through your skin. Nicotine gum. Nicotine gum is not used like ordinary chewing gum. You chew it a few times and then park it between your cheek and the space below your teeth. The nicotine is absorbed mostly in your mouth. Nicotine nasal spray. Nicotine nasal spray comes in a handheld spray bottle. You use one spray in its nostril frequently throughout the day. The medicine is not inhaled. The nicotine is absorbed mostly in your nose. It's usually prescribed to people with severe nicotine addiction. Nicotine lozenges. Nicotine lozenges look like small hard candies. You put one in your mouth between your gums and your cheek. You may feel a warm or tingling sensation as it slowly dissolves. Do not chew it or swallow the lozenges. The nicotine is absorbed mostly in your mouth. Nicotine oral inhaler. The nicotine oral inhaler is a small plastic tube shaped like a fat cigarette. You puff frequently on it with shallow puffs throughout the day. Unlike an asthma inhaler, the medicine is not inhaled into the lungs. The nicotine is absorbed mostly in the back of your throat. Combination of quit smoking medicine. Using a combination NRT starts with putting on a patch each morning to get a steady level of nicotine all day. Then, you also use a nicotine medicine like lozenges or gum that works more quickly to help deal with urges or cravings when you feel them coming on. You can also talk with your healthcare provider about other combination of quit smoking medicines that may improve your chance of quitting for good. The last one is quit smoking pills. They do not contain nicotine, so it works differently than the nicotine replacement medicines and require a prescription. Varenicline. Varenicline is a pill you take twice a day and you start taking it at least 1 week before you quit. Pros: it's simple to use, so may be easier to stick with it. Your chance of successful quitting with a single medicine is best with varenicline. Varenicline gets in the way of nicotine in the brain, so you don't enjoy nicotine as much if you use a cigarette. Varenicline can gradually reduce your smoking since you start taking it before quitting. Cons: varenicline need to take it with food or a full glass of water to help avoid nausea, and may cost more if you have to pay for it yourself. Possible side effects: nausea or vomiting at full dose, sleep disturbance, constipation, and change in your mood or behavior. Bupropion. Bupropion is a pill you take twice a day, and you start it 1 until 2 weeks before quitting. Pros: it's simple to use, so may be easier to stick with it. It may help delay weight gain associated with quitting. If you have depression, it may help. Bupropion can be combined with nicotine patch under the care of your doctor or other healthcare provider. Cons: more possible side effects than other medicines and cannot be used if you have ever had bulimia or anorexia, a seizure disorder, or are taking or recently quit taking an MAO inhibitor medicine. Check with your pharmacist or doctor if you are unsure. Possible side effects: nausea, dizziness, difficulty sleeping, constipation, rash, seizures, nervousness, and change in your mood or behavior. Many smokers sleep and smoke a cigarette while they are quitting smoking, but don't use a sleep as an excuse to start smoking again. You may try these ways to get back on the track. First, feel proud of the time you went without smoking cigarettes. Think about ways you avoid your triggers and bad cravings. Try to use those ways to cope again. Second, it's important to restart quitting right away, today or tomorrow at the latest. Don't give up on your goal of no cigarettes at all. Third, you don't need to stop using an RD after you sleep and smoke 1 or 2 cigarettes. Using an RD increases your chance of staying smoke-free for good. And then, ask your family or friends for help to stay smoke-free. You don't have to do it alone. Last, think about what you learned when you were not smoking. What helped you to stay smoke-free and what caused you to have a sleep. What can you do differently now to help yourself be smoke-free again? Besides taking quit smoking medicine, you can also consult with your pharmacist to help you quit. Counseling and taking medicine are the best ways to help you quit smoking. The pharmacist has the potential to play a crucial role in assisting patients in smoking cessation. Through counseling and assisting with product selection, pharmacists can help patients quit smoking successfully. There is clear benefit to this strategy in reducing healthcare costs as well as improving overall health status. By implementing smoking cessation strategies into daily patient interaction, pharmacists can greatly impact the lives of their patients.